Hello, my friends. It's the Barefoot Boomer, and it is July 9th, 2026. And I've been promising along the way to do an update on my HPV P16 positive squamous cell carcinoma base of tongue cancer journey. It's been a while. It's been about 3 years. So I wanted to get it out of the way, get it posted. The response that I've gotten to my previous video and my first video were, really, to me, amazing. And thank you, all of you who have reached out with encouragement. And my heart goes to all of you who have reached out, who are either going through the journey themselves or have friends or family members who are going through it. It's not fun. Never will be. But just kind of wanted to update you on where I am in my journey and, encourage all of you who are going through it and to hang in there. And remember that even though we're going through after effects from treatment or going through the side effects of treatment, if you're in the middle of it, it does get better. And it's certainly better than the alternative. Just like 4 things that I wanted to kind of review as to where I am. I am literally now 6 years out of treatment. So far, there's no evidence of disease, or if you hear the term NED from anybody, that's what that means. No evidence of disease, in remission, it's all the same. No signs of cancer, either residual from the original diagnosis or metastatic anywhere. So that's always a relief, right? Things that I've dealt with in the last 3 years is because of the cisplatin chemotherapy infusions, I've lost some of my high frequency hearing. I do have hearing aids that I wear depending on the situation that I'm going to be in. I'm sure my kids would wish that I wore them all the time, but hearing aids are hearing aids. The best thing I like about them is that they're Bluetooth to my phone. But loud noises are hard to deal with. They just kind of get louder, but hey, I can still hear. I use them when I need to. Grateful that I have them. Grateful that I caught them at a good price through my medical insurance. So it's all good. The other thing that I've gone through over the last couple of years is with scar tissue in my throat, fibroid scar tissue. A couple of years ago, I was starting to have more and more issues with food getting stuck around the epiglottis and under the epiglottis flap and not being able to pass it. 2 years ago, I ended up at the emergency room with a very tiny piece of meat because I only eat little tiny pieces of meat at a time that had remained stuck for about 12 hours, which is, not the normal. Usually if something gets stuck, it'll pass on its own within 5-10 minutes, but this was like 12 hours. So I went in. They ended up doing a procedure to literally go in and retrieve it. And then it was recommended that I have what's called a dilation, where techs go in or the doctor goes in and literally stretches out your esophagus to stretch out that fibroid scar tissue, which has very little elasticity. It opens up your throat so you have easier swallowing, things pass easier, tend not to get stuck. Some people have to have that done every 2 or 3 months. It's been 2 years, and some people never have to have it done. But I did have a situation last week, which was kind of prompted me to do this video for you again. The first, I took an aspirin because I had a sinus headache, and at about 2 o'clock in the morning, and on the 1st, and at 2 o'clock in the afternoon on the 1st, it was still stuck. Still felt like it was stuck. So I called the advice nurse for my medical plan, told her, I don't think it's an emergency. Can you get me into an urgent clinic? but I've got to get this thing moving because it hurts every time I swallow. Pass water, everything else, but it still hurts because it feels stuck. And she couldn't find any urgent clinic appointments available, so she said, let me call the doctor and see what the doctor has to say. So we did that, and he said, no, get your ass to emergency. There's nothing in urgent clinic that they can do to help you. Well, he ended up in emergency. They did a CT scan. Nothing was stuck. The next morning, they did a scope, and what they found was that the aspirin had caused a chemical burn in my throat. Figure, right? Aspirin gives you ulcers, but it caused a chemical burn in my throat. And so they, while he was there, it was actually the same doctor that did the scope that had done my dilation 2 years ago, and he said, as long as I'm here, I'm going to do it. So I had a second dilation, so that helps with the swallowing. But even now, almost a week later, my throat is still sore from the burn, so got to be careful on stuff like that. The other major problem, 6 years out, and again, some people have issues, others don't, is teeth deterioration. The biggest reason is because those of us who suffer from lack of saliva or very little saliva, saliva helps keep your teeth healthy. It helps with bacteria. Food doesn't get stuck in your teeth as much. And I'm one of those unfortunate ones that has about maybe 25% saliva. So my mouth is often quite dry. Brush my teeth. I'm careful with my hygiene. But because it's not there and my teeth are dry a lot of the time, especially at night, I've started having teeth deterioration. I've lost probably 5 or 6 molars. I've got a couple more that are actually getting ready to fall out, which only exacerbates eating, in chewing and swallowing, which is hard enough without the saliva there. But that's my biggest problem right now. And because of the opportunity for a necrosis of the jawbone, which is damaged with radiation, in order to have any major dental done, you've got to go see an oral surgeon. They need to also determine if your jaw is healthy enough for dental work. So that's working on that process. And even if my jaw is healthy enough right now to do the work that I need to have done right now with an oral surgeon would be $13,000 out of pocket, and that's not going to happen. So that's an issue I'm dealing with. So those are the 3 major things that I deal with. I'm finally able to maintain my weight without worrying about losing it. I gained about 5 pounds and I'm thrilled. I don't really want to gain any more weight, but I'm happy with where I am. But it's a struggle. My eating, especially after having weight loss surgery 20 years ago, is so counterintuitive to the way that I'm used to eat, because I do eat high calorie. I do eat, as my nutritionist says, anything that you can eat that adds calories. So, but I feel healthy. I've finally got back to the gym to do strength training and a little bit of cardio. I've started taking hula lessons, and if you know anything about hula, it's not just hula, it's hula, it's Hawaiian language, it's cultural, it's spiritual, and it kicks your ass. So that's good. I enjoy that, and that's my get out of my head every week. Other than that, I'm still overall feeling healthier physically, emotionally, spiritually than I have in my whole adult life. Living the single life. I love it. I'm happy. My life is going well. What can I say? Don't hesitate to reach out to me if you're going through this journey. I'm happy to share my journey with you. I don't give medical advice, but I'll be happy to share what my journey is and support you in any way I can. I love you all. Hope you're having a great weekend and a good summer. Take care of yourselves, and we'll have more soon. Take care. Love you. Bye.